I'm just going to introduce myself a little bit. I, a lot like Doug, did not think when I graduated from vet school that I was going to become a holistic veterinarian. It was not my goal. I did want to work with athletes, so I really thought I was going to do a lot of large animal and mostly athlete dogs. But what happened very quickly, as you can see, I graduated in 2001. By 2003, I was already going on to get more education in veterinary medicine because I very quickly, as many of you probably have, which is why you're here, I very quickly felt limited by what I could do with what I learned in vet school. You know, those old arthritic patients, I could give them Rimadyl or Tramadol. And if that didn't help, then there wasn't much else I could offer them. And that became very frustrating to me. So as you can see, I kind of went from very similar to Doug, acupuncture, then I did rehab, then it was chiro, then it was Chinese herbals. And this is sort of the path that you wind up on. Once you start to learn a little bit about the importance of whole food nutrition, you almost just can't get enough of it. And I, like Doug, am also a huge proponent of raw food feeding. So we'll talk a lot more about that as I go. And I know some of the other speakers are going to talk about this as well. So just getting into the meat of things, you will see this each time a speaker talks, so I will not go through this either. There's a picture of myself. I live in the boonies, so there was no way that I could have my screen sharing up. So I apologize for that. So here we go. As Jody mentioned, I'm going to talk about the what and the why. Doug also talked about the why more on a cellular level. I'm going to talk about why on a little bit of a bigger picture. The first thing is, if you live here in Wisconsin, which I know many of you don't, but I think there's very similar laws in most of the states. This is actually Wisconsin's informed consent law for veterinarians, and we're required to follow this to maintain our license. So I'm just going to quickly read it. Failure to inform a client prior to treatment of the diagnostic and treatment options consistent with the veterinary profession's standard of care and the associated benefits and risks of those options. So what I find really interesting about this statement is this is sort of the definition of holistic care, right? Because we need to talk about the range of treatment options. We don't just get to have a pet come in and we just say, okay, I'm going to give you this medication, goodbye, good luck, right? There's a lot more that goes into this. So in my opinion, informed consent sort of describes that we should all be doing holistic medicine or an integrative approach. Doug had a specific holistic definition with a big long list of stuff, but a more obvious definition of holistic is it's holism. It's looking at the whole picture. So this is weight, mental health, what are they eating, how much exercise are they getting, right? So holistic is the whole picture. And same with integrative. Integrative is looking at all of the pieces and parts, right? Their diet, their supplements, their drugs, whether we're doing physical interventions. We see this and do this every single day. So I think on some level, we should all be practicing an integrative or holistic approach. If we take the average overweight Labrador that I'm sure everyone sees at least once a week come into the clinic, whether they're young and they're struggling with hip dysplasia or whether they're a little bit older and they have arthritis, we go through all these things. We talk about the fact that the dog is overweight. That is talking about diet because they are getting an excess, as Doug mentioned. I do also focus a lot on quality of diet, though, and we're going to talk more about that. But, you know, we did mention both Doug and I are raw food proponents. But even if you're not, you are looking, too, at the record and saying, oh, geez, you feed Old Roy or Alpo. I don't even actually know if they make that anymore. But the equivalent of that, the Costco brand, that's, you know, $15 for a 40-pound bag. So we are all talking about nutrition already. We just need to focus and be a little bit more clear with our goals for our patients. We're also talking about supplements. Most people would see that dog and say, okay, are you on a joint supplement? Are you doing fish oil? Pharmaceuticals, depending on how bad that dog is, we are talking about NSAIDs and pain relievers. We might be recommending thyroid testing or x-rays, depending on how severe that dog is. We also are going to talk about physical interventions. So, you know, my practice, we can offer all sorts of things because we do have rehab and acupuncture and chiro and laser and PEMF. But you are still saying to the client, well, don't have him go up and down the stairs so much, or give him non-slip surfaces, things like that. So we are all practicing a somewhat integrative, holistic approach already. We just can sometimes do a better job of it. So to kind of finish up the legal stuff, just with informed consent, this is what our records might look like, our plan for that older, heavy guy with arthritis. Yours is not going to maybe include all of these things, but it doesn't matter. We just have to make sure we're looking at the whole picture with these patients. I just have a note on here. Wisconsin's informed consent does require that we talk about cost. So we do actually give an estimate for anything that they do consider doing. So moving on, what is as important or more important than the law, of course, is the dog or the cat, or if you're an equine vet, the horse. So the benefits are, there's such a long list. This is a very short version, but the gist of it is, if we are practicing better medicine by giving the patient better nutrition, we're going to have a better patient outcome. If we have a better patient outcome, we have a happier client. The happier our clients are, the more confidence they're going to have in our recommendations, and the more likely they're going to do all of the things we recommend instead of just some of them. The other thing is once they become a more loyal client, they are going to improve our revenue. We don't do this because of the revenue, at least I assume most of us don't, but it is an added bonus with a healthier pet and a happier client, because that client is referring their friends, they're coming back in for every single recheck we recommend, they're buying the products that we recommend. So improved revenue is an added bonus. I have on here just the increased number of pets during COVID. Doug mentioned millennials. The research that I looked up that was done by the Pet Products Association in the last couple of years was the difference between 2020 and 2021 was I know there's a lot of 20s here, sorry, $20 billion in pet expenditures in that difference of 1 year. And the bulk of that was in OTC medicine sales. So that's stuff that you are not necessarily having any control over. So we need to get control of some of that back so that we make sure that they're on things that we want them to be on. So now we're going to move into a little bit of talking about how to integrate functional nutrition. Everybody's different, right? My approach is going to be different than your approach, whether you're small animal, large animal, whether you're talking to somebody who knows a lot or knows a little. All of our approaches are going to be different, but there are a couple keys that are really important to remember. The first one is just to be humble. With social media and the internet, Doug and I both graduated before those things existed. And so it was a lot easier for us to sort of joke 20 years ago when somebody would come in and say, well, my breeder said, and we used to kind of joke behind the back and go, oh, what vet school did your breeder go to, right? We all kind of hear that phrase. But the fact is, now I do have clients coming in that know a lot more than me about certain things. They don't have a veterinary background, absolutely, but they may have a pet project or a favorite breed that they do know oodles about, some weird disease in Basenji that I haven't even heard of yet that they just discovered, with all our new genetic testing. So I really do try to come from a place of, okay, maybe you do know more than me. We're not sure yet, so I have to find out a little bit more, because with the advent of online, all the internet stuff that they can do, as well as social media, we do know that some of the information is false information as well. So it becomes our job to sort through that. And this is where having a very open, honest conversation with people with no judgment. We actually have in our clinic mission statement that we have judgment-free zone, basically. We talk about it a little bit more professionally than that, but that's the gist. We try to talk to people. We hear their ideas. We share our ideas without implying any guilt or trying to make people feel bad about their things. Because if we're making people feel bad about decisions that they made, they obviously made these decisions trying to do what's best for their pets. So when we tell them they've done a terrible thing, now they feel horrible, and we're actually going to damage our relationship. And if I damage my relationship with my clients, I'm no longer going to give that good care to that pet, because they're going to go somewhere else, or they're going to not be truthful in the exam room about what they're actually doing. So I like to use phrases like, oh, I'm not necessarily familiar with that product. That doesn't mean it's not good. It just means I haven't heard about it yet. You tell me more about it. Or instead, if I actually know it's not good, I might say, well, I'm not really familiar with that product and I don't use it, but here are the ones that I choose to use. And then I tell them why. And then I go into talking about certain companies like Standard Process, as well as others, do quality testing and things like that. I also use phrases like, oh, in my hands, I don't find that that's as effective, or things like that. So we really want to remind the client all the time that we are on the same team. So what I really start with is I start with a very simple approach, and I start with things that I know that the owners can easily accept, or maybe already do accept as fact. They've just not really thought about it yet in canine nutrition or feline nutrition. They think about it in people all the time, but they don't necessarily think about it in pet foods, because until very recently, kibble is socially acceptable, right? So people don't really think about the issues behind that. So these are some of the things that I sort of touch on. I'm going to come back to freshness. Quality of ingredients. Doug really already talked about this. Whether it's pieces and parts, whole food versus synthetic, where it's coming from, if the proteins are meat-based or soy-based. We have carnivore patients. Again, I apologize to you equine folk. They are not, obviously, but our cats and our dogs are carnivores. So it does matter if they're getting soy proteins versus meat proteins, because we know that those amino acid ratios are all different, even in different meats, of course. So I really just talk about these basic things. Calories. Calories is a new thing now that is on our feeding labels, right? I think it was 2 years ago, 3 years ago, we had to start adding it on the nutrient labels. But clients can understand that calories are not equally available or helpful. People can know when I talk to themselves about themselves that steak and salad calories do not equal a Happy Meal or stopping at Culver's for a hot fudge sundae. You may get the same amount of calories, but clearly the nutrition is different. So on top of talking about these things, freshness is a big thing. And obviously Doug touched on this, but I want to talk a little bit more about it, because we do know for a fact that heat processing damages food and all of its vital nutrients. So the more times an ingredient is processed, the less value it is going to have in the food. We do know that like some of the ingredients in dog foods have been heat processed 3 times before they even bake it into the dog food. So can you imagine what's really left after multiple processing? Not much. What's interesting is, and as I mentioned, owners do believe these things to be true when they're talking about human food, but they don't necessarily think it to be true or haven't thought about it yet. So it's our job to kind of allow them to start thinking about new things like this. So the goal for my patients is the least processed possible. I have possible in italics because possible is different for everyone. What's easy for me may not be easy for the next person. And this goes back to a little bit about the open and understanding, non-judgmental conversation that I have with my clients, because I want to know what my clients are willing and able to do, what is truly possible for their pet. And if I'm kind of closed-minded about how I talk about it, or I'm a little bit too much of a know-it-all, like, oh, you have to do raw or you're going to kill your dog, if I do that, what can happen is my clients aren't going to be honest with me. So I might think I'm sending home this fantastic supplement and they're not going to refill it again. Or we might talk about improving their food choices and they may nod, and then walk out the door and go, I can't do that, right? So this is where being open and honest really does make a difference, so that the owner knows we're on the same team and we want the same thing. I'm just going to mention the book, The Forever Dog. It's there's good and bad about this book for sure, but what I absolutely love about this book is the amount of research that went into writing it. So if you have any interest about knowing more about what Doug talked about and what I'm talking about with freshness, The Forever Dog has oodles and oodles of research and studies that are documented in there. And so it's really a fantastic reference for people to use. And so, well, Doug said, one of the questions that Doug answered, I guess, is if a client won't go off kibble, what can you do? He mentioned standard process. Undoubtedly, standard process is an excellent tool, but there are a lot of things. So, diet changes is one that we talked about. Toppers is another thing. We all sort of can agree that if a client gives table scraps or training treats or whatever it is, they're not going to totally unbalance the diet, as long as it's somewhere between, everybody throws out a different number, 10%, 15%, 20%, right? So if they can use that amount of food and not unbalance the diet, they can use that with toppers just by adding fresh whole foods. So one of those options, of course, is standard process. Other options is just actually whole food. So a lot of my clients like to do this, and it really allows them to feel like they're doing something. Obviously, supplements is another really big choice. Not only should foods be fresh, but as Doug talked about, they should be whole when possible. Doug talked a lot about this, so I won't, but I do talk a lot about this to my patients because we don't realize, not only did Doug say that lycopene, for example, is not as helpful as whole tomatoes, but some things can actually be harmful. Alpha-tocopherol, there was a meta-analysis done many years ago. Alpha-tocopherol is a form of vitamin E, one of the components of vitamin E, and it's generally recommended that humans get about 400 units of vitamin E a day. And this meta-analysis, it was over 10,000 people, 200 different studies that they looked at, and the patients that were taking, and again, this is human, but the patients that were taking 400 IUs of just alpha-tocopherol and not whole vitamin E, they actually had an increased risk of cancer. So what we need to remember is components and pieces and parts, while they may be not as helpful, they actually can be somewhat detrimental. So I am really a proponent of whole foods as well. So statements that I like to use with my clients is, and these are things, you guys all use your version of it. You don't have to say this, but, can you imagine eating the same cereal for the rest of your life? If a client has just told me they've been on vacation, I love to say, oh, you know how you feel when you're on vacation and you're not eating very many fruits and vegetables, things like that. The other thing I do is I also remind my owners that there is indeed no perfect food. Even if they're going to do raw, there's no perfect recipe, right? So if you have a Chihuahua, a Great Dane, a lazy Basset Hound, a busy golden retriever or border collie, we know that there's no perfect recipe that is going to be ideal nutrients for all of those patients. So what I tell people to do is to rotate food. And the concept here is all those different individuals are going to have very mild excesses or deficiencies in different nutrients. And by rotating their diet, and that's both brand, meat source, and if they can, freshness value. If they're rotating all of that, those animals' bodies get to pick and choose with those natural feedback loops that Doug sort of talked about and that whole food nutrition. They get to pick and choose what they need. And so that is actually an easy way for my clients to really feel like their dogs are getting a more balanced diet, even if they are on kibble. The other thing that I sort of mentioned too is they just have to do the best they can. And this is where I like to talk to them about what they're doing. And so we will follow up when they're doing food changes for the very first time. Food changes look different for all of my clients. For my raw food feeders or somebody like myself, my dogs eat something different every day. For patients that have been in the same kibble for say 5 or 6 years, I'm not going to tell them, feed them something different every day. That is going to upset that dog's gut, right? So those patients, I might supplement with some digestive enzymes. I'm going to have them gradually transition. But once they start transitioning, these dogs' guts do tolerate this better, and it's going to be healthier in the long run for them. So the biggest beauty about this approach is not only does it change outcomes, but it also allows owners to feel like they're doing something. Doug mentioned some numbers. Here are some more. I just was sort of looking around in both the JAVMA and an American Pet Products Association survey. Our clients are already doing supplements, and they're doing a lot of supplements, right? The Pet Products one said it's only 45% of clients. Fly bulldogs were 90%. I would argue that most of the athlete clients, whether they're equine or canine, they're doing a large percentage. 44% to me seems really low. But the point is, they're doing something. So we have the opportunity to make sure that it's a healthy choice, a good choice, and that they are spending their money on doing something that's not just good marketing, but is actually going to make a difference. And that's what clients want, right? They want to know that they are doing what's best for their pet, and they're trying hard to do it. And so we can help them. The other important thing then is not just to make recommendations, but to actually monitor our progress. I do that sort of in I have two different categories with this, because there are going to be some supplements and diet changes that the owners are going to see differences themselves right in front of their face every single day, right? And then there are going to be others, and we're going to talk about that, they can't see the changes. So those are monitored differently. with the clients that we're making changes that they can see in their pet, I actually have them keep a log. I literally tell them, please don't bring me in a huge long diary. We don't need to see that. But if you keep a paper calendar with those little squares, what I want you to do is take 2 corners on each day. On the left corner, on a scale of 1 to 10, I want you to just tell me how your dog is overall in that day. Good, bad, average, super happy, you name it, on a scale of 1 to 10. And they need to be fairly objective about it and not say, oh, I trimmed his toenails, right? Just how's your dog doing? And then in the second corner, what I do is I'm specifically having them look at the thing that brought them in as their complaint. So say it is a dog who is having difficulty going up the stairs. So on the bottom right corner of their calendar, I'm going to have them on a scale of 1 to 10 talk about or rate how their dog does that day in a very objective manner. Did he go up at all? Did he look really stiff? So the reason I have people do this is human nature is such that even if that dog, if I call them back in a month, and even if that dog is bringing on the toy more often, going on longer walks, doing all of those things are actually so much better. If the dog is still struggling to go up the stairs, and that was one of their primary complaints, they're going to say to me, geez, the dog's not really that much better. I'm a little bummed about it. And so this objective way of having them actually write down and put it on a scale of 1 to 10, that dog may have gone from a pain level of 8 down to 4 overall throughout the day. He just is still having a problem getting up and down the stairs. So that does 2 things. It, one, allows me to monitor the dog's progress and my plan, but it also allows me to change the plan more effectively. Because now if the dog is better all day long and is playing more and doing more things, but still having a hard time going up the stairs, the pain has improved, but maybe now I need to talk about massage or chiropractic or something like that because that dog is stiff and has physical restrictions, right? So monitoring is a huge deal. The second kind of group of supplements that we talk about are the ones that the owners can't see. We have these all the time, right? Whether it's a mild elevation in the ALT because the dog walks through something outside, came back in the house and licked off their feet and now has a ALT of 200, or whether we're monitoring omega values, vitamin D levels, things like that. It becomes really important that we stay on top of monitoring that progress. What we do for our patients is we choose not just an appropriate time frame to see improvement, but we also have pretty concrete goals. So that's going to be different for every disease process and every supplement that we add. You know, if we add something like boswellia for pain or milk thistle for an ALT, we're going to see a difference within a couple weeks. Skin conditions, so we all know, can be more frustrating and can literally take months. But by setting concrete goals, and being very clear with our clients, it does a couple things. One is it actually shows our client that we are truly not only interested, but committed in the outcome. The reason this becomes important to me is I don't know how this exactly happened or why, but when I went to vet school in 2001, we were considered one of the #1 respected professions in the country. We are no longer that. And I'm not sure how it happened. To be honest, I was at State Fair a couple of years ago, and there was a doormat that said, my vet drives a Porsche. I'm not actually sure what that means, but it's not a compliment. I'm pretty sure of that. So somehow over the last decade or two, we have gone from this really respected profession to somehow now there's this image of vets driving Porsches and raking in money hand over fist. And that's why we're doing the job that we do. So I like being very clear with my owners that I do care about the outcome. I'm going to follow up with this. So we place callbacks in our system. Again, everybody's system is a little bit differently. We can place a note that we get a reminder to send them an email. We can call them. But I'm following up and checking whether it's at 2-week intervals or 2-month intervals and making sure that these pets are improving. And if they're not, then we can make better recommendations. The other thing is that's helpful about this is if you're just sending everybody out the door and not really knowing how they're doing, how are you ever going to become better at practicing this, right? Every time I get that callback that goes, geez, it actually didn't work so great and he's not that much better. Now I not only am changing that plan for that particular pet, but now in my head I'm thinking, how do I need to approach these cases a little bit differently so I can more effectively treat these issues in my patients? So this is the fun part, right? We finally, by having more to offer our patients than my 20-year, 20 years ago example of Rimadyl and, Tramadol, now I can say, okay, here's what we can do. There's in fact so much that we can do. My coworkers and some of my clients always sort of tease me about pretending that I'm MacGyver, because if I have a phone call or a case where somebody says, boy, it's this weird disease, they want to know if you've ever treated it before, I say, well, no, I haven't, but there's a ton we can do. So bring them on in. And that is the truth. The more you start to understand nutrition and supplements, we're doctors. We know the pathophysiology of these diseases, so we know what should work. Will anti-inflammatories work? Will antioxidants work? So it's wonderful, because by switching to an approach of whole food, both whole food itself and whole food supplements, a whole world opens that we get to start changing the lives of our patients. And it is like, this is the fun part. There's no lie. Okay, I'm going to get into now, without talking about specific products, I'm going to get into now how well some of these cases respond to functional nutrition, and what are the easy cases to start with for those of you who are not already doing it. If you're already doing it, I know a lot of this is going to be really redundant for you, but if you're not, this is a great place for people to start. I also remind people, please don't underestimate what food and supplements alone can do. There are patients, like allergy patients, that this is kind of all we can do is food. Yeah, there's some pharmaceuticals, but this is the bulk of how we change these patients. And I'm telling you, I have up to 70% of my patients do remarkable on diet and nutrition alone, and not with pharmaceuticals. So we're going to talk a lot more about that. The other great advice I got in 2003 from Dr. Shea at Shea Institute was, don't act surprised. So, and I often am still in my brain when in 2 weeks, some patient comes back and they already look so much better with some natural approach that I did. But I try to be cool about it, right? And not act like, oh my gosh, I can't believe that worked. Instead, it's, oh my gosh, I'm so thrilled that that worked. Feel free to tell all your friends. So we're going to start with arthritis and joint dysfunction, because this is a big one that we obviously all see. Diet, we didn't talk a whole lot about specifically that diet can be pro-inflammatory, as Doug led to a little bit, as did I, when we talked about heat processing. So we know that foods can actually be pro-inflammatory. Foods can also just be neutral. That is what most of us hopefully are eating. And then there are some kind of anti-inflammatory diets like the keto diet. I'm not going to talk a lot about that, but I really just do want to mention that in all of these diseases that we're going to talk about, we do need to make sure that the food that they are eating every single day is not pro-inflammatory. So we really want to cut down those inflammatory mediators in those heat processed foods the best that we can. So I don't have those listed on these slides because, diet is kind of a given for me. The other big thing, though, about diet with arthritis patients specifically is we need to keep them lean. That becomes very important. We all know that. Every extra pound or two, especially if it's a front limb thing, makes a huge difference. So onto my list. The first thing is joint protectives. We pretty much all talk about this now, I think, as part of standard of care, because joint supplements are available everywhere. The goal, of course, is finding a quality one, but they should have in them glucosamine, chondroitin, green lip muscle, things like that. A little asterisk next to green lip muscle is, of course, there's environmental impacts that come with that. I'm not going to talk about that today. I do talk about it with some of my clients, though, because I do have a very holistic clientele, and they do care a lot about that. So these products are excellent because they're not only joint protective, but they're also anti-inflammatory and help increase joint fluid production. So those are all big things in joint cases. Omegas, Doug is going to talk a lot more about that later. He already touched on it. One of my favorite things, though, about omega-3 is that it has been proven to upregulate the gene that makes the enzyme that breaks down cartilage degradation products. I literally use that phrase to my clients, even though it's long and wordy. And then I follow up by saying, I think of it as like sweeping out the joints, keeping them clean. So if we have a patient that has arthritis, it's going to stop, hopefully, the arthritis where it's at in the affected joints, and it's going to help protect the other joints. So I use a ton of omegas. Next on the list, glandular support. The beauty of glandular support is where everything else on this really is the joint protections are very joint specific. The beauty of the glandular is they support white fibrous tissue and muscle. So white fibrous tissue is ligaments, tendons, muscle insertions, joint capsules, everything that supports the musculoskeletal system. I use a lot of glandulars in spondylosis patients because what we know is even though people loosely call it back arthritis, spondylosis is calcification of a ligament. So if I can make that ligament healthier, I'm going to have a better orthopedic process in that pet. Other things are anti-inflammatories. There's a ton of herbal anti-inflammatories at our disposal. Boswellia, turmeric, cat's claw. So, always reach for herbs. I try to reach for herbs before I reach for NSAIDs. They're safer. They're easy on the kidneys and liver. Sometimes they even have GI protectant properties like turmeric. So I like to use herbal anti-inflammatories a lot. Gotu kola is another fantastic herb. It increases the microvascularization to white fibrous tissue. What I say to my clients is, you know how you're supposed to take ginkgo for your brain? Gotu kola is that same thing for your joints. So I use a lot of gotu kola, especially in my ACL injuries, not just the partial tears to protect that tear, but to support the other side. So there's many others when it comes to orthopedic stuff, MSM, Fetal M, hyaluronic. I use a lot of hyaluronic acid. Hyaluronic acid is the thing in the joint that makes the joint fluid more viscous. And as you can imagine, the more viscous the joint fluid, the more cushion. So the more comfort you're going to have and the less additional arthritic development you're going to have. So there's another product too that I didn't list on here is a product called Myos. I don't know if anybody's using this yet. A lot of the athletes are on it. It is actually for muscle building. So Myos is a egg yolk supplement that actually helps to increase muscle volume. So whether it's a post-op or a pre-op injury where they've lost muscle mass in one leg or an atrophied older patient, Myos can really make a huge difference with that as well. Just kind of to mention, I'm not ignoring Adequan. Adequan is an excellent product, and there are some other excellent injectables, but because they're injectables, they don't really fall in this category. Next big category is GI tract disease. I have a few things listed. There's a lot of stuff, right? This is a big category because there's everything from upper GI, way upper, esophagitis, reflux, to gastritis, to middle tract disease like IBD, to lower tract disease like colitis, flatulence, things like that. So this is a huge, area that really does need to be broken down. But here's kind of things to just start with. Probiotics are a huge one. Probiotics and prebiotics. Probiotics, there's a lot of different versions out there. I have a couple favorites that are specifically formulated for pets. VisBiome is a great one. Animal Biome makes one. So there's some good probiotics out there. And I'm sure you all know by now probiotics are the good bacteria that live in the gut. I always pair that with some version of a prebiotic. What a prebiotic is a fructooligosaccharide, which is the chain length fiber that's the probiotics, so the microbiome likes to eat. So with a lot of these patients, depending on what they're eating, they are not getting enough prebiotics in their diet alone. So you may be giving them probiotics and those probiotics are not surviving in their gut. So I do a lot of fructooligosaccharides. If I'm doing that as a supplement, it's bananas. A lot of my clients do pumpkin. That's a really easy one. The fiber also helps to normalize the stool, but it's a prebiotic. Another thing is digestive enzymes. Digestive enzymes I use a lot when I have a patient that has gas. It can be gas from either end. So it can be burping, belching kind of stuff, or it can be, clearing the room, melting your eyebrows kind of flatulence. What gas tells us is that those patients are not digesting their food appropriately, and that food is fermenting in their gut and making gas. So digestive enzymes can make a huge difference with those guys. Anti-inflammatories are another huge thing that I use. The reason I have both omegas and glucosamine listed, there are of course more, But I very specifically look at my whole patient when I'm deciding what gut anti-inflammatory to put them on. Omega is great in my young patients that have skin issues. That's going to be the anti-inflammatory I choose. But if I'm seeing an older patient with arthritis, I may choose glucosamine. A lot of people don't think about glucosamine as a GI anti-inflammatory, but it is, because we know that glucosamine is anti-inflammatory to all mucosa. So, mucosa is the lining of whatever the organ is. A lot of us think about it in bladder for those fluted kitties, but it's also great for the gut. So if I have an older patient, glucosamine can be a good anti-inflammatory for their GI tract as well. Enteric support, I cannot talk enough about glandulars. Glandulars are just fantastic because we know that the GI tract is a quickly growing and quickly repairing. It's why it's so sensitive to chemotherapy. But it's also then very sensitive to nutritional support. It doesn't take a lot of nutritional support for us to start seeing changes in the health of the gut. A couple things I don't have on here. There's an amino acid called glutamine. Glutamine is going to be deficient in pets, especially dogs eating high carb, low fiber diets. And the reason that is important is glutamine is one of the amino acids that is responsible for the tight junctions of the GI tract. So we talk about in my holistic practice, leaky gut syndrome and poor tight junctions, which is why toxins and things are getting into the animal's gut. Glutamine can help repair that. There's also a plethora of herbs. The reason I didn't list them is, again, they really are dependent on an upper, middle, or lower GI tract. But things like ginger, turmeric, cinnamon, plantain, peppermint, there's a lot of herbs out there that can really help to aid with different GI disease things. I just want to mention vitamin B too. We do a lot of cobalamin testing, obviously, with GI tract disease. And when they are deficient, we do recommend injectable vitamin B. But when we see GI tract patients earlier on and they're not cobalamin deficient, they can actually benefit from oral vitamin Bs. So we will give a whole complex vitamin E supplement to a lot of these GI cases, especially kitty cats with you're not really sure if they have inflammatory bowel disease or lymphoma. Oral vitamin Bs can make a humongous difference. Next kind of group of things is going to be these skin guys that we see. It's very important to talk to clients about a short-term plan and a long-term plan. We all know that when we see these critters, when they first walk in the door, we're not really worried about the long-term plan. We're worried about comfort. The dog that I have in my mind is that red, dog with lesions, and it's wet, and it's damp skin, and it's scaly. These are, just hot, gross dogs. And I can't use a very natural approach with these guys and make them comfortable in the short term. So our short-term plans usually, or at least very commonly, involve pharmaceuticals, whether it's antibiotics or antifungals, whether it's some sort of anti-inflammatory or Apoquel or Cytopoint to help itch, whatever it is, we have to treat these guys in the short term because to heal their system in general takes a lot longer, and owners don't have the patience for that if they're bringing to you a miserable pet, right? So kind of to mention again, the diet needs to be not pro-inflammatory, right? So any diet change is probably going to help with these guys. The other big thing is we need to support their gut. I'm sure you remember from vet school the whole GOLT system. 60% of our immune system is located in our GI tract, is in our gut. So all those things from the last slide about the GI tract, those are included in the allergy and atopy treatment as well. Anti-inflammatories, similar ideas. I add antioxidants. And then there's immune support products, which we haven't really talked about yet. That can be glandular immune support. It can be medicinal mushrooms, colostrum. And for people who aren't aware yet of magical mushrooms or don't know a lot about it, I encourage you to do some research. We are finding more and more information about mushrooms and the fantastic effects that they have on the immune system, on brain health, on anti-neoplastic properties. So mushrooms are pretty magical. So I definitely recommend learning a little bit more about them if you don't already know them. Obviously, with skin patients, we're talking about antihistamines as well. Our natural approach to antihistamines can either be herbal, something like licorice and nettle, Animal Essentials is a supplement product out there that makes a product called Seasonal Allergy with licorice and nettle and burdock and eyebright in it. It works just fantastic. And in my hands, I do find that the herbal antihistamines are really just as effective and often more effective than pharmaceutical antihistamines. The data that's out there is the average dog, antihistamines, drug antihistamines are only about 40 to 60% effective. That's not great. I do find that the herbals are more effective in a higher number of patients. So I recommend you thinking about that. Quercetin works great as well. The other thing that I think about is detoxing things, whether it's milk thistle or standard process. I know I'm not supposed to talk about it, but they have a great detox called Antronex. It helps to clear histamine from the system, and decreasing their histamine levels is going to make a big difference in the comfort of these patients. Next group of diseases that we're going to talk a little bit about is autoimmune inflammatory neoplasia. I group these all together because the unfortunate thing is I treat them very similarly. Obviously, there's differences between autoimmune and cancer, but the bottom line with this group of diseases is we need to support their immune system. We need to help it out. So even in autoimmune disease, which is overreactive, if we normalize their system and support their system, we're going to decrease a lot of those symptoms. And in neoplasia, the reason we talk about supporting the immune system, obviously, is I need the immune system to kick it into high gear and help to get rid of the cancer. Or if they're on chemotherapy or something like that, and supporting the immune system through the struggles that they're going to have through treatment. So this is one kind of disease process that diet is critical. So I kind of loosely talked about, I think all of our patients should be on not inflammatory diets. But this is a category that if we can actually get them on an anti-inflammatory diet, it is going to be helpful. Again, neutral is fine, but anti-inflammatory is better. Keto is kind of a hot topic in humans. I know it's a little bit debatable in veterinary medicine as well, but I do find that the keto patients do really well with cancer, cancer patients do really well with keto diets. We know that carbohydrates feed cancer, so the keto diets can actually help us to starve those cancer cells. Again, I don't have listed on here gut. Treating the gut is crucial, especially if they're having chemo or they're on a lot of pharmaceuticals. Taking care of their gut is going to make a difference with their immune system as well. Immune support, we talked a lot about that with the skin cases, medicinal mushrooms. Many of the mushrooms have just phenomenal anti-cancer properties. So I really encourage medicinal mushrooms. Antioxidants are fantastic when we're dealing with the secondary inflammation caused by cancer itself. And I apologize that I did not put this on this slide, there should be a big fat asterisk after antioxidants, because antioxidants cannot be used in chemotherapy patients. Specifically, the way chemotherapy works in most of our pets is we're killing off, well, in humans as well, is we're killing off cells. And as those cells die off and make free radicals, we are hoping that it is then killing the cells around it. And that is part of the way we're dealing with cancer, whether it's chemo, radiation, we're dependent on our free radicals. So if we use antioxidants in those patients or things with antioxidant properties, we're actually going to decrease the efficacy of the chemotherapy. The local oncologists that I personally work with, they know this. And so if they do catch it, they're going to talk about it, but they don't always catch it. So I am really careful about talking to my clients if they have not decided yet if they're going to go the chemotherapy route or see an oncologist, and make sure that they know the products that cannot be used with chemo. So again, I apologize I didn't put a big fat asterisk after antioxidants. Herbals are obviously used a ton in cancer patients as well. There are several out there. Artemisinin is a big one that has anti-cancer effects. IP6 inositol, this is actually not an herbal. It is a naturally occurring carbohydrate that is in all plant and animal cells anyway. But PubMed published a study in 2003 talking about IP6 and how it enhances chemotherapy. And even without chemotherapy, it decreases metastasis by increasing apoptosis and cell death of the cancer cells. So I use in a lot of IP6. I do use a lot of herbs, whether they're classic Chinese herbal formulas like Hoxsey or Western herbals like artemisinin. So herbs are a fantastic thing to add. They are obviously a whole food nutrition. They are meant to be used synergistically, which is why a lot of them are in what we call in Chinese medicine, if you do any of that, we call them traditional Chinese herbs because they've already been worked out, the synergy between the different herbs and how well they work together. So I use a lot. The other thing I want to mention though about herbs is herbs are insanely powerful and strong. They can be just as strong as pharmaceuticals, in my opinion, sometimes stronger. So if you are not used to using herbs, I truly recommend that you have an excellent formulary at your disposal. I also, if I have a deficient sort of patient, they're unthrifty, they have an upset GI tract, they're weak, I generally start at lower than the actual recommended dose because I don't want to push these fragile little creatures over the edge as I'm starting their treatment. Nothing's worse than when you send home some wonderful products with an owner and the next day you call back to see how their visit was and how things are going, if they have any more questions, and now the patient has raging diarrhea or won't eat because they put all these new products into their food the night before. Organ-specific dysfunction that I want to just mention, again, I have just excellent luck with functional nutrition alone with these patients. Hepatopathy, well, this is a really broad category, of course. We see a lot of patients, as I'm sure you do as well, that we're doing routine screening blood work and they come back with an ALT of like 150 or 200. And you go, geez, I'm not really sure what to do about this. It's probably nothing. Maybe they just licked something off the bottom of their shoes, but I don't know for sure, right? So we're going to put them on milk thistle or SAMI or turmeric or glandular, and then I'm going to recheck them in a couple weeks. So to be perfectly honest, milk thistle is the thing I start with. If it's a really mild thing, that's all I'll put them on sometimes and then recheck 2 weeks later. Renal disease, glandulars, I cannot speak enough about glandulars in feline renal, especially disease. Old kitty cats respond famously to glandulars. We see cats that their creatinine, when it's of course mild, will come right back into the normal range and they can stay normal for years. So I'm a huge fan of the glandulars in especially the senior kitty cats. I do like Azadil as well. If you're not familiar with that product, I do recommend looking into it. It is a probiotic that very specifically competes with nitrogen-producing bacteria in the gut. And what that means then is if I increase the nitrogen in the gut, I decrease the BUN in the system, and BUN is what makes these poor cats feel crappy. So if I decrease the BUN, I'm going to have a happier, healthier feeling kitty cat or dog, right? I use it in dogs as well. So a couple other things that respond to nutrition alone is hypothyroid disease. These thyroid guys do great on glandulars, whether it's the glandular specifically for thyroid or immune support as well, because it's considered an autoimmune thyroiditis. Cardiac disease, glandulars again, CoQ10. The thing that I do not have on my list is seizures. I treat a lot of seizure patients with functional nutrition alone. Many of them come to me already on pharmaceuticals, but I do not necessarily start there. I start with a more functional nutrition approach that includes an anti-inflammatory diet when possible, antioxidants, and the big one is CBD or hemp. I really see patients that come to me on medications and are doing poorly. With the addition of hemp, they do wonderfully. I want to asterisk that point as well, and this is why I didn't put it actually in my slide, is here in the state of Wisconsin, we are not allowed to recommend hemp. So if my clients come in and they're already on it, the board position in Wisconsin is that we are allowed to provide available information and express concerns, but we are not allowed to actually prescribe it for our patients. So I always kind of cross my fingers when I see a seizure patient that they specifically ask about it or their patient is, or their dog is already on it. So hemp can really be fantastic. You just legally still have to be a little bit careful about how you're talking about it. So in conclusion, just do it. You probably, a ton of you are already doing a lot of these things. If you're not, pick one supplement or two supplements and just start using them in all of your cases. Or all of the appropriate cases, I guess I should say. Also, start with mild cases. If you start with mild cases, you're going to be really impressed with your outcomes. Again, don't act surprised. Have a really open conversation with your client. I can't tell you how much my clients literally appreciate that I, quote, think out of the box. One of the big complaints that I see, because we get a lot of, as a holistic practice, I get a lot of second opinions coming from other practices. And one of the main complaints I get was, well, when I tried to talk to her about fill in the blank, she crossed her arms and didn't want to hear it. So this is where be open-minded, have an open conversation with your clients, and you're going to have better results with your pets then.